What are the most common medical malpractice claims? Hi, I'm Frank Spector, medical malpractice lawyer in Maryland and in DC. And this question came on my website. Person wanted to know, what are the most common medical malpractice claims? So I can tell you from my experience, they really fall into two big categories. The first are surgical complications. I get lots of inquiries, phone calls, internet inquiries about surgical complications. Now, it has a lot to do with orthopedic cases, or it has to do with knee surgery or hip surgery, a lot of back operations, spinal fusions, what we call laminectomies, which is removal of diseased discs in the back, neck surgeries, surgeries that go down in the arm, carpal tunnel syndrome surgeries. So anything that involves surgery. It could also be other surgeries that involve like removing of the gallbladder, a repair of some kind of aneurysm or weakness in a blood vessel. So there's lots and lots of surgeries that are being done in the United States each year, millions and millions, and the complication rates, unfortunately, are getting bigger. So getting calls from people about potential surgical complications is certainly by far the biggest. Second area would be misdiagnosis. So we get a lot of calls about people that feel that they had a particular disease that wasn't diagnosed properly. It could be cancer, a misdiagnosis. They go into the doctor, they think that they feel a lump, or they have some symptoms consistent with cancer, and the doctor tells them that it's not cancer at all, but later they find out that it is. It can be a misdiagnosis of some kind of infection. We've had cases involving misdiagnosis of loss of vision and what that's from. So there can also be lots and lots of misdiagnosis cases. So I would say those are the two most broad categories. One other category that we get a lot of calls about, and they really aren't medical malpractice cases, but I feel for people because there's a lot of dissatisfaction with the way that the medical profession treats people. It's become very impersonal, and a lot of times doctors don't have the time or the personality to be able to make a patient feel good. They don't call the patient back when they're supposed to. They keep the patient waiting in the waiting room for a long, long, long time. They don't check on them after surgery. They're nasty to them. They don't listen to them. They're not respectful of what they want to say. They're not really looking at them as an equal person. They feel that they're the doctor and they know everything. So there's a lot of dissatisfaction in the medical, profession from patients. And I get a lot of calls just about that. I get a lot of calls about the fact that doctors don't fill prescriptions promptly, or that people need life-saving medication and the doctor doesn't call the pharmacy and they have to keep calling back and back so many times. Those aren't really cases because again, in a medical malpractice case, you have to prove a mistake or a medical negligence, and you have to prove that there's some kind of permanent injury. And so having sort of what I call bedside manner, which means the way a patient is being treated, not medically, but, from one to one, from human being to human being, that's not really the basis of a medical malpractice case. But I do have to say that that's a lot of calls and inquiries that I get about patient dissatisfaction. So there are lots and lots of medical malpractice situations. I just sort of summarize what the most common are. So if you enjoyed this video, please hit that subscribe button. You'll be able to take advantage of all of my future videos, and it really helps me out a lot too. I have my contact information below, my website at frankspectorlaw.com. That's frankspectorlaw.com. I'm going to put a link to that at the bottom. I have a lot of great content on my website, answers a lot of questions about medical malpractice. And also, if you subscribe to this channel, you're going to be able to take advantage of all of the good content that I'm putting out there on medical malpractice. So thanks so much for watching. Hope you found this informative. I look forward to seeing you again on another video.